fam, welcome back. I've been missing for a while, but I'm here today to say hello, and I want to talk a little bit about the negative side effects of steroid use. You guys know I told you some a while back that I had been on steroids. I had gained the 25 pounds, and I think I was trying like some type of detox tea or something. I'm at work, so I'm trying not to talk extremely loud, and I also need to block out the names on this wall. But and I don't want to interrupt the patients either. But you all know the things that I experienced. I was fortunate that it didn't increase my blood pressure. I'm gonna talk about the negative effects of steroids. I have been on steroids probably much my entire life. Not constantly, that's not what I'm saying. I suffer with sinuses and allergy problems. So I've had tonsillitis when I was a child a lot. My tonsils stayed infected, and I always kept strep throat. So I would be on steroids on and off, even as a child. As I got older and turned 21, I decided to get my tonsils removed. That eliminated the strep throat, but it didn't eliminate me still having these bad sinuses and allergy problems. I was started on a allergy injection, and the injection worked pretty good. I did it for a couple of years. My sons are affected with it also, and my daughter, a bad heredity trait. But to fast forward to the steroids, I've been on them a long time, as long as I can remember. Like I said, nothing constant up until last year. As you guys know, last year in February, I started steroids, prednisone, the mid-draw dose pack, one between the other, Celestone injections, uh, um, Depomedrol, Solumedrol. I was on just a lot of different steroids trying to get my sinuses and all this under control. I was on those steroids for about 2.5 months. I ended up gaining a lot of weight. It does affect your appetite, but it also helps make your body retain fluid. That was a problem that I had. I gained 25 pounds, as you all know in one of the prior videos. I gained 25 pounds in 2.5 months. And I also retained a lot of fluid. I can recall going to work and standing up for about 12 hours. And I mean, my legs, my feet would be huge. My face was like so swollen with fluid. And my face is still fat, but it was like big, full of fluid. Um, but those are just some of the things that I want to talk about. If I had a known better when I got in school, I started school again, of course, in January 2019 to get my RN license. And of course, you're going to go over the same things that you went in LPN school. But when you've been out of school for a long time, like me, about 15 years, it's a refresher. It's like a refresher course because you're going to hit some of the stuff that you went over in LPN, then you're going to get into some of your stuff in your RN. And as we touched briefly on steroids, I can't recall what body system we were talking about. I want to say maybe the endocrine, but don't
Quote
count me.
me.
I don't remember. But it was like a wake up call. I was like, oh my God, because that was, like now the doctors used to prescribe steroids all the time, no matter what if you had a upper respiratory infection, steroids. Your arthritis flared up, steroids. Lupus, steroids. And hold up, I'm gonna get to that because if you have like these acute or chronic and autoimmune diseases, you can possibly be taking steroids for a long term. But I'm talking about like for a short term. If it was me, like now, I sway away from steroids. After I went through that, I thought I had a heart condition because I was swelling my hands, legs, feet, my stomach. My entire body was swelling. I ended up going to a cardiologist and everything. I had my kidney workup because at first I'm thinking kidneys. Kidney workup was fine. Then I was like, well, maybe my heart. Everything boiled down to steroids. Steroids, short of breath, walking, short of breath. I mean, a lot of things that I had never experienced before. But I pulled up on this computer some things to tell you all about steroids. I can remember a lot of things off the top, but I pulled up on a computer to just so I could relate back to this computer and tell you guys a lot of things about the steroids, about the negative effects. And I'm talking about like the corticosteroids. I'm not talking about the anabolic steroids. I need to block these names out, so I gotta watch how I sit. But you know, the anabolic steroids, those are like the juice steroids, the steroids that these men use to shoot themselves up to get these muscles. I'm not talking about those type of steroids, which they have negative effects too. But I'm talking about the corticosteroids. I wouldn't want to do juice steroids. If I couldn't get my muscles the old fashioned way, I wouldn't worry about no muscles. But everybody different. And you know, the doctor might do a little anabolic steroids to try to speed up your recovery from a surgical repair, you know, athletes and stuff a little bit. But I'm not talking about anabolic. We're talking about corticosteroids. So stuff like prednisolone, and kids get prednisolone. As I mentioned, Celestone. I'm talking about things like that when it comes to steroids. Also, the inhaled steroids that you can inhale, people that has asthma. I'm talking about things like that. But I'm more talking about the ones that you take by mouth. I'm talking about the injection, because that's where I ran into trouble at. But steroids, we know they cause weight gain. We know they cause fluid retention. But they can also affect your mind. They can cause depression. Some people actually experience depression with steroids because of the negative side effects of it. Steroids can cause you to have hypertension. You end up with a blood pressure problem that you never had before. But once you get off of those steroids, your blood pressure should return, you know, to the normal level before your steroids. If you're a diabetic patient, guess what? Steroids will increase your sugar. If you already got diabetes, it can increase your sugar and cause your sugar to elevate more. So you have to always keep a check on your sugar when you take it. You should keep a check on your sugar anyway. But when you're taking steroids, you might have to check your sugar. If the doctor order you to check it twice a day, you might have to check it 3 to 4 times a day when you're on steroids. And like I said, for autoimmune things, I'm going to look at this computer because I'm just talking off the top of my head. But corticosteroids, we know it's an anti-inflammatory and immune system suppressant, because just like I stated, for like lupus, for rheumatoid arthritis, you might have Crohn's disease, ulcerative colitis, lupus, cancer, anything like that. The doctor can give it to kind of suppress your immune system so your body don't kick against it and help you to get over it. If not get over it, control it. You want to help minimize that flare up. Weight gain, headache, fluid retention, muscle weakness, obesity. You can get facial hair. You can get that buffalo, that little buffalo hump. The moon face that I had when I was saying my face was like super, super swollen. Moon face. And then also when you're taking steroids, you need to be careful to talk with your doctor to make sure that it's not going to interfere with any previous medication that you are taking. It can interact with like seizure medicines. It can interact with your diuretics like your Lasix and things like that. Do not drink alcohol when you're taking steroids. I don't care what nobody tell you. It's not going to hurt none. You shouldn't drink alcohol and taking no medication, because you got some people tell you, oh, a drink is not going to hurt none. Don't do that to yourself. If you're taking some medicine, don't drink nothing. Just finish your medicine out. Let it do what it's going to do. Work to the fullest. And you can get your drink when you finish, when you complete your prescription. Loss of potassium. Thinning skin makes your skin thin. It can also cause muscle weakness. So and it also causes irregular cycles. And I already stated about that buffalo hump and all that. Also, let me tell you another thing about steroids. Steroids suppress your immune system, and you are prone to infections. So when you're on steroids, you might have a sinus infection, you might have a tonsil infection, you might have something going on, and you might be on an antibiotic. But you have to also realize that the doctor should tell you that steroids can suppress your immune system, because that's why they give it to you. To suppress whatever inflammation you got going on. Just as I stated up here, it's immune system suppressant. So wash your hands all the time. Hand washing is the best way to prevent any type of infection. When you sneeze in your elbow. But remember to wash your hands. Avoid large crowds. If you're taking a steroid and if somebody having a party, you want a party, avoid large crowds, because if somebody has some type of infection going on, you are immune to catch it because you are on an immune system suppressant. Oh my, I'm sorry. my low battery thing came on. But I would just like to tell anybody to weigh your options before letting the doctor put you on steroids. What I would do first is take whatever prescription they give me, and doctors know a whole lot. I'm not saying that they're very smart, but what I would do is weigh my options first, because now it's so many negative effects. I just told you all just a little bit. It's so many negative effects to taking steroids now. But I would weigh my options first. What I would do is maybe try antibiotic. I'm gonna use myself as an example. I was sick back here last year from November to December. I did all I could to keep from taking those steroids because, to remind you, I have been on it 2.5 months, 25 pounds that I'm still stuck with. Excuse me, school, work, busy life, don't have time to work out at all. But I took antibiotics twice before I decided to get one injection of Solumet. And I don't think it really affected me that much because it was one dose, but I was so skeptical about taking those steroids. So if it was me, I would weigh my options first. I would try to treat myself first, and I want you guys for yourself to read up on the negative effects of steroids. Now, steroids, like I said, have some positive effects because you have more positive effects when you use it short term. But long term use is when you run into your negative effects. Diabetics, be sure to check your blood sugar accordingly. People with hypertension, be sure to check your blood pressure accordingly. If you're checking it once a day, you might need to check it 2 or 3 times a day when you're taking steroids, because it can possibly increase your blood pressure. So that's just a little FYI. And I also just want to come back to say hello to my fam. Y'all know I miss y'all. I'm busy all the time. I'm working agency, so I'm pretty much commuting to a lot of places to work. Today I'm at the local hospital that I used to work at. I worked here 2 weeks ago, and 2 weeks prior I hadn't been here almost a year. So they caught me at a time where I didn't have anything scheduled at the moment, and I picked it up. It's closer to home. May not make the money that you make with agency, but it's closer to home, and any money is better. Some money is better than no money. That's how I look at it. Plus, it's more laid back here. You ain't got to worry about working hard like you work hard with agency. But I'm grateful for whatever God throws my way, because I know He's the one to make a way out of no way. When you can't see your way, He gonna come through. Stay positive, be blessed, and enjoy this video. Let me know your feedback. Let me know what you think. Let me know your experiences with steroids. Have a good day, bam bam. Boom.